Hi, I'm Dr. Ed Beyer. I'm a chiropractic physician in Tinley Park, Illinois. In our clinic, we practice functional medicine, functional neurology for managing and supporting people with chronic illnesses. One of the biggest things we hear is this: Doc, I'm on Synthroid, I'm on levothyroxine, I'm on hormone replacement therapy for my thyroid, and I'm still gaining weight, and I'm still tired, and I'm still losing my hair, or I got gut problems, or I'm depressed, I'm cold all the time, I need to sleep all the time. These are common thyroid complaints that we hear. You need to understand there are literally dozens of ways that your thyroid can go wrong that your doctor does not address. Today I'm going to talk about number one. I'm going to be making several videos on this, so be looking for them. This is the first way that your thyroid function could be depleted, and no matter how much hormone you're taking, it doesn't matter if you have this. And here it is. Your thyroid function starts in the brain. You have an area of your brain called the hypothalamus, and then you have your pituitary gland. These are in your brain. These are what control your thyroid and a lot of your hormones. Now, there's a particular group of neurons in your hypothalamus called the Paraventricular Nucleus, the PVN. These neurons make what's called thyroid-releasing hormone, okay? They look at the levels of T4 and a little bit of T3 in your blood. When these levels drop, the hypothalamus, the paraventricular nucleus, will detect this, and it'll send out thyroid-releasing hormone, which is from the brain, to the pituitary gland to release thyroid-stimulating hormone, TSH, the one that your doctor looks at all the time. Okay, but it starts in the hypothalamus. Now, here's the deal. These neurons in your brain, the paraventricular nucleus, need proper levels of two very important neurotransmitters in order for those neurons to work. Those neurotransmitters are dopamine and serotonin. If you have a dopamine deficiency or a serotonin deficiency, these neurons in your brain will not work, and your thyroid mechanism, your thyroid function will not work like it should, no matter what you're on, okay? And by the way, dopamine and serotonin do a lot of other things. Dopamine allows us to focus, it allows us to be motivated, it allows us to enjoy things that are pleasurable. Serotonin is very important for frontal lobe activity, to keep us happy and to allow us to sleep. So if you have some of those symptoms, you might have a serotonin dopamine deficiency. Now that we know that, what can cause a dopamine or a serotonin deficiency and thereby affect your thyroid function? Number one cause is blood sugar dysregulation, what we call dysglycemia. If your blood sugar is going too high or too low, or both, which we see in a lot of our patients, this patch of neurons that allows your thyroid to work right in the hypothalamus will not function properly. So we have to restore good blood sugar levels to get your thyroid functioning well. Another common thing that we see that will affect dopamine and serotonin production is a lack of B vitamins. You need B vitamins in order to convert your amino acids into dopamine and serotonin. Certain tyrosine for dopamine and tryptophan for serotonin. A lot of people have genetic defect called methylene tetrahydrofolate reductase, or an MTHFR enzyme that is not working right and not allowing you to activate your B vitamins in your body. We test for those when we see our patients. There are many ways, folks, that your thyroid could not be working, or possibilities. If you're suffering, we really recommend that you look into this. Hope that helps.